everyone, greetings. It's Dr. Anna Petropoulos at the Center for Classic Beauty on Boston's North Shore with our lovely patient Lisa. We did Botox together about 2 weeks ago for her frown lines. Now, she had and still has an extremely deep vertical frown line. This is not possible to go away with Botox alone, so now I'm going to test and see if our Botox treatment was successful. And I measure success by seeing if this offending muscle here, called the corrugator, moves or not. So Lisa, could you frown real hard? You can see that Lisa's frowning really hard, but this muscle is not moving. So that means that our Botox treatment was successful in inactivating the offending down-pulling corrugator muscle. So the Botox treatment was 100% effective, and now the next step in Lisa's goal of effacing the frown line is a filler. So I'm going to use Juvederm right now to fill this line and make it look much, much better. So we'll position Lisa in a very comfortable position and continue on. Hello again. We've repositioned Lisa in a horizontal position so it allows me easy access in line with the wrinkle and tangential underground to the wrinkle. So this is Juvederm. I will give a little stretch to the skin and I will enter at 45 degrees and then go tangential to the undersurface of the skin. And Lisa will probably feel a little pressure here as the Juvederm is going in, and it has numbing medicine in it, so she shouldn't feel any discomfort. And I'm going very, very slowly to allow the numbing medicine or the lidocaine to take effect. And now I'm injecting on withdrawal with my needle tented upwards for the first portion of that line. So now this area should be nice and numb, and I'm going to the second portion of the line, depositing a tiny little drop, and I'm working from a numb area to an unnumb area, and that's why it diminishes the discomfort. So Lisa, how's it going?
Great, thank
Is
you.
it tolerable?
Yes.
Oh, good. On a scale of 1 to 10, what would you say the pain factor is?
A 3.
A 3, so not too bad, right?
Right.
So now I'm going to my third prick as I work my way down the line, numbing as I go along. This injection should be done by very skilled personnel. I know every Tom, Dick, and Harry is wielding needles and doing injections, but this area can be very dangerous because of vascular occlusion. So you really have to know what you're doing and really have to be well trained. Vascular occlusion means that a blood vessel could be inadvertently blocked and you could have skin necrosis. So you really need to know what you're doing when you do this. Okay, so a little more. You can see that this line is very, very reticent and persistent, and it wants to stay. It doesn't want to leave its residence. So I'm treating at different layers, different depths. Now, someone might ask, well, why don't I just put filler in and not bother with the Botox? The reason is if you don't have Botox to prevent this movement, that muscle will keep contracting and will squish away the baby collagen that is trying to fill the line. It will also squish away the filler that we are injecting. So it's really important before you do your filler that you have your Botox on board. And you can see that her line is much better than when we started. It will improve even more, and she can always have more filler later. So she's very presentable, can go right back to work, and no one will know she was here, except that she looks much happier and does not have as prominent a line. So what do you think, Lisa?
I love it. Thank you so much for helping me. I appreciate your time and your talent. Okay. I love it. You are the best. I highly recommend you to all my friends.
Oh, thank you, Lisa.